Just want to say good morning, everyone. Thank you for joining us today. My name is Alexandra Albizu-Jacob, and I'm co-presenting along here with Enya Vroom on the issue of striking a balance between program fit and fidelity in evidence-based practice. So what can you expect in the next 90 minutes? Well, first, Enya and I would like to take some time to provide a basic overview of a few key concepts in implementation science that have been known to demonstrate tension in practice. And this will help set the stage for the bulk of the session, in which we will engage in a discussion with our incredible community partners over here, who can attest to the real-world experiences of implementing an evidence-based practice. But before we get to that, we'd like to start off with defining a few key terms, starting with evidence-based practice. Just note throughout the presentation, we will be using terms like evidence-based program, evidence-based practice, intervention, innovation, and EBP interchangeably. We know these terms do not necessarily mean the same thing, but we will just be referring to them collectively. And so it's important to know, first off, that the use of evidence-based programs crosses multiple disciplines from the medical field to community-based behavioral health services. And with that comes some natural variations in how the term is defined and understood. So one way in which the term is conceptualized is the emphasis on the need to demonstrate empirical proof of its effectiveness. Meaning you want to be able to demonstrate the effectiveness above and beyond no treatment or treatment as usual conditions. And another way EBPs are defined, still takes into account research evidence, but also takes into account clinical expertise and the accumulated experience of the professionals delivering the interventions. So this definition is broadly defined and thus tends to cause some confusion. So for the purpose of this session today, we will be talking about EBPs within the frame of that first definition. We're going to talk about why are we talking about EBPs, really? Over the last few decades, there has been an increasing recognition of the need to improve the processes and outcomes for serving children and their families. And with that, there's been a development and rapid growth of EBPs in behavioral health and public health. So while this use of EBPs has increased, we know that that does not necessarily mean that these programs will be used effectively. And so this issue was pointed out by the U.S. Surgeon General report on mental health in 1999 and reinforced by the President's new Freedom Commission on Mental Health in 2003. And so this commission recommended that all clinical practice be rooted in a foundation of evidence, and that is really what this movement is all about. So this is really where the vital importance of implementation science comes into play. And so it's worth noting the lengthy amount of time it takes to get research into practice to translate something like an evidence-based program into something that's viable and will work for a community. And in that process, it's very easy for critical components and context to get lost in translation along the way. And so what implementation science attempts to do is to bridge that gap and facilitate that process of the research to practice integration, meaning that implementation science is the study of methods, variables, interventions, and strategies to promote the adoption, support, and sustainability of EBPs. So why is the field of implementation science so important? Well, a common misconception is that by simply identifying an EBP and implementing it in a community that you'll be guaranteed to see positive outcomes in your community. After all, these are programs with demonstrated effectiveness, right? Well, however, the program itself may not be enough, but it's also the processes involved that lead to those effective outcomes. So, for example, you can have an evidence-based program with its demonstrated empirical proof of its effectiveness. Great, but it fails when implemented in the community. So the question to ask is, was that context in which it was implemented appropriately considered? So according to Massey and Vroom's figure here, there are 6 main factors identified across various implementation models that have been shown to affect the success of implementing an innovation. This includes the characteristics of the EBP, the professional, the client, the organization, the community itself, and the overall implementation process. And the presence or lack of any of these factors can either serve as a facilitator or barrier to the overall implementation process. So you also have to consider how each of these factors interact with each other, adding to the complex nature of program implementation. We know it's not an easy thing to do, right? So to this point, I'd like to give a hypothetical example, if you will, of how these factors can interact and influence one another. So here you have the characteristics of, let's say, for example, an evidence-based prevention program addressing adolescent substance use, right? So this program was obtained via a reputable source, has a strong strength of its evidence and apparent advantages to its use. The cost is reasonable, and the complexity is at a medium level. However, it's the period in which you can do a trial run of this program and its level of adaptability are low. Now, within the organization that has opted to implement this program, you have leadership with an adaptive style, you have efficient management processes, you have a healthy organizational climate. I mean, it's the golden organization to work for. And you even have the presence of a program champion. However, this organization is severely limited in terms of its resources and the funding mechanisms that can support the implementation of this program. What could happen in this scenario? Well, this organization may experience some significant challenges due to its lack of resources and the program's lack of trialability and adaptability, and that can impact the implementation integrity. However, this organization may be better equipped to handle these challenges, given all the great things about it, from its climate and its management and its leadership. So, getting more specific with our topic of discussion today, we want to point out that there is that noticeable tension in the research community between fidelity and adaptation and fit. And Enya will touch more on this in her talk in just a moment. But I wanted to talk about what the idea for the discussion was today. It really emerged out of the interest to explore that tension, but from the perspective of those who are tasked with actively implementing these programs in their community. So the goal of the session overall today is just to provide a background of these concepts and to really get into a discussion about what these topics look like in real-world settings. So with that, I will now pass it off to Enya.
Good morning, everyone. How we doing? All right. Some enthusiasm. I like it. Again, my name is Enya Vroom, and I'm going to continue on with defining some key terms and concepts. So fidelity has been variously labeled throughout the research literature. Some of you may have seen it labeled as integrity, treatment fidelity, or implementation fidelity. Simply put, fidelity can be defined as the extent to which a program or innovation is implemented as it was originally designed or intended. So we're really talking about measuring and maintaining those active ingredients of a program that are critical for programmatic success. Pretty simply put, right? Okay, well, let's complicate things a little bit, as us researchers really love to do. I'm only joking. However, we would like to do some myth busting in terms of people thinking that fidelity only involves adhering to a program manual, which we can see is the first core element in this figure. So as we've come to realize, fidelity has actually evolved to include more than just adherence. And as we see in this figure, we can see that it includes a couple others, such as dosage, the amount or frequency or duration of a program that a client or participant receives. You also have quality of delivery, which is how well the components of a program are delivered. Next, we have participant responsiveness, which is the degree to which a program stimulates interest and is understood by a target population. And lastly, we have program differentiation, which is a program's theoretical roots that influence the program and make it unique from others. So there's research that actually states that there are more core elements or components of fidelity. For example, we have program reach and adaptation we'll get to in a couple minutes. But we just wanted to give you, or at least highlight these 5, to give you a sense of depth of fidelity and some important things to consider in terms of monitoring and evaluating fidelity. So why is fidelity important? There is a significant evidence supporting the relationship between participant outcomes and fidelity. So in other words, fidelity can act as a potential moderator between participant outcomes and the intervention itself. This is why it's very important to monitor and evaluate fidelity. A comprehensive evaluation of fidelity is really crucial in understanding why a program succeeds or fails. So if fidelity is not monitored or evaluated, it makes it very difficult to determine whether the failure of a program is related to poor implementation, the shortcomings of the program itself, or other additional variables. So monitoring fidelity and program implementation can also assist with improving fidelity by providing that crucial feedback and encouragement for implementers, as well as identifying barriers that may hinder the success of the actual program. So balanced against this concern of fidelity, there is also the need for evidence-based practices to fit the communities and populations where they are actually implemented. So not all EBPs are necessarily created equal, and considering how a program fits within a community, organization, and or with its clients is very important. So frequently, heavy emphasis is really put on that internal validity piece of the research studies, leading programs and practices to be developed and tested with narrowly defined homogeneous populations. So this emphasis on internal validity may come at the expense of external validity and the effectiveness of interventions across different populations. What do we mean by fit? The fit of an EBP in an organization includes not only taking into consideration resources and capacity, but also culture, community preferences, and the acceptance of professionals that recognize the unique needs of their clients. Therefore, adaptations may be necessary in order to deliver an intervention in a real-world setting. So adaptations can be defined as modifications or changes made to a program to better serve the needs of a particular setting or to increase the fit of a program to a target population. So for example, this may look like changing the amount of time required to deliver the actual program or changing the examples within the program curriculum so that they become more applicable for the population of interest. So this brings us back to some of the domains Alexandra took us through earlier, like the community, client, and organizational characteristics, which also tie into that implementation process. So to address concerns with adaptation and fidelity, it is critical for consumers, meaning the organization and providers, to identify those core or active ingredients of a program and to preserve them during the adaptation process. So if significant modification does take place, it is incumbent upon the implementers to conduct those thorough evaluations to assess the possible impact the changes may have had on outcomes. So now we've discussed both fidelity and adaptation separately, but what about balancing the two together? Tension exists in the research community over the competing ideas of fidelity versus adaptation. So some argue that adaptations are essential in order to meet the needs of a particular setting, while others argue a program that has been adapted will be significantly less effective when compared to the original program. So this distinction really rests with the emphasis on generalizability in real-world settings versus the emphasis on ensuring the effectiveness of a program under clearly specified conditions. So now I want to give you a little visual of this tension that we've been talking about. So looking at our topic today from the organizational perspective, this really gives you an idea of the direction the demands are coming from in regard to fidelity and adaptations. On the left side of the figure, this is where we're really seeing the fidelity component. This is where the research and the science is coming from and can be directed back towards our organization in the middle. And the needs on the right side of the figure may not necessarily be taken into consideration on what's going on the left side. So on the right side of the figure, this is where we're really thinking about the client perspective. So we're asking ourselves, is this EBP relevant for this client base? Is it practical? Will it or is it being accepted by them? And on the community level, are we seeing community acceptance and support? Is this EBP in line with the cultural and practical needs of the community? So these demands and these client and community perspectives are also being directed back towards the organization. So here we're in the middle, we're actually talking about our organization. This is happening on the organizational level. So here we are in the middle where we have the actual organizational, which includes the administration and providers, but is not limited to just administration and providers. Here they're figuring out if the EBP is really practical for them as well. Is the EBP accepted by their providers? And do they have the capacity to deliver the EBP? And on the administration level, we can think about things like leadership. So is the leadership supportive of the evidence-based practice? And if not, how is this affecting the providers? So taking it to a few steps back and looking at the whole thing, we have the external demands coming from the Fidelity side. We have the external demands coming from the Fit and Adaptation side, and they come to converge here on top of the organization, which are also trying to compete with their own internal demands. So why could this be a problem? And why is this important? So this is happening obviously at the organizational level. This is where the services are being provided, and if this tension isn't dealt with, it could potentially lead to issues with the adoption, implementation, and/or sustainability of an evidence-based program, and therefore could interfere with participant or client outcomes long term. So for example, the organization may be trying to adhere to those funders' goals, but at the same time trying to take into consideration the needs of the client and/or community. And these two may not necessarily be in favor of one another. So coming back to this convergence of tension over the organization, the question that remains is, how do you balance these competing demands in real-world settings? So overall, the long story short is more research is needed, to identify the appropriate balance between fidelity and adaptations. However, for right now, what does this look like in a real-world setting? And how do we make it practical? How are organizations dealing with this? So, to dive a little bit deeper into our discussion of topic today, we've invited incredible representatives from 3 local community agencies to discuss their experiences with this topic. To start, actually, we have Kimberly Menendez from the Menendez Foundation. Kim, if you just want to give us a little brief introduction of yourself and your role at the Menendez Foundation.
Sure. My name is Kimberly Menendez, and I'm the Senior Curriculum Developer at the Menendez Foundation, and we produce 2 programs. One is called Too Good for Drugs, and the other one is called Social Perspectives or Too Good for Violence. These programs are evidence-based, and they are available and used in schools and community settings for grades K through 12.
Wonderful.
Yes.
Margarita, if you'd like to introduce yourself.
And my name is Margarita Romo, and I'm the Director of Farm Worker Self-Help in Dade City. And we are a grassroots organization. And so I'm here to share what we have been doing and also to learn.
And we have Jeannie.
Hi, I'm Jeannie Wilsey. I work for Hillsborough County Children's Services. I'm a therapist in our outpatient program, and I'm here to talk about our outpatient and some of our residential programs.
Wonderful. Well, thank you 3 so much for being here today. Let's go ahead and get started with our questions. My first question is for Kim. Kim, as a program developer, can you tell me a little bit about how Fidelity and Fit figure into operating your program?
Yes. So as an evidence-based program and to, continually maintain that efficacy, we go through the random control trials to basically set the standard that we're evidence-based. And when we go through those trials, it produces what we call at our organization the model for fidelity. So we have that as basically what we, it's on the national registries, we have it on our website. It breaks down exactly what that fidelity model is. And then as far as fit, what typically happens is, and this is just general, it happens many different ways, but, schools get grant monies in order to implement some kind of evidence-based program for substance use or violence prevention. And then that's where that tension starts to happen. And we really try to work hard, to work with those who are looking at our program to see if it actually is a fit. So you spoke about dosage. That's important. That's part of our program that we tend to not change because that's what we have the data on. For example, the typical dosage of our programs, depending on the grade, but in general, it's, once a week for 45 to 50 minutes for 10 weeks. But some schools and community organizations, while they're mandated to have an evidence-based program, that may not fit what they have available in their setting. So we try to, and we're always open to learning because, it takes a long time to really know how to handle this best. But, we we try to work with them as much as possible that if there is some kind of adaptation, we don't want it to be, a drastic mutation. So a drastic mutation that we experience frequently might be, I just need this evidence-based program. I need to have it in school. I need to report that I'm doing it. And they don't have much guidance that, it needs to, or they're so much in a rush, and it's understandable because these organizations are super busy. They may not fully comprehend that it's a 10-week program. And so sometimes they might take 5 of those weeks and cram it into, a one-time session in the gym, like a pep rally kind of thing. And that we would consider a drastic mutation. So we try to help them to build capacity, to the 10 weeks. We don't have data necessarily on what if you just do 9 weeks, or what if you have 9 weeks but you do 2 lessons in 1 week. That seems to be more of what we would say, a reasonable adaptation. We just don't have necessarily the data on every single possible adaptation that there is. So what we've been trying to do is, if we partner with these settings early on, and there is time to do so, we ask them just to simply track, and we help them to track what that adaptation might be, and then do their student outcomes, their pre and their post tests over there, but then also to measure their implementation outcomes. Were the other core components of Fidelity met? So if you have strong student outcomes in the 9 weeks, then possibly 9 weeks is an inconsequential adaptation that's still producing some strong outcomes. We just don't have the efficacy study on that. So that's how we've been trying to strike that balance, because I believe, and I think research supports it, that any amount of an evidence-based program is helpful. So we would never want to say, if you don't have exactly this, now there are sometimes we say, our program is not a fit, but we really do try to work to help them build capacity to hit on each one of those components of Fidelity.
Awesome. Thanks, Kim. Okay, so Margarita, I actually want to turn this next question to you. So putting aside the topic of Fidelity, what is important in terms of program adaptation for your community?
Well, for us, and we've had a lot of experience with trying to come together with organizations that have the knowledge that we do not have, but do not know how to act out in our community. So, years ago we had a young lady that was sent to us from a university to be with us for 5 weeks, and that was part of her graduation program. And she came, and she had a total culture shock. She was with us for about 2 days, and she was saying, I want to go home now. And so I put her on a bus and sent her back. And then her program director started calling us saying, she won't be able to graduate if she doesn't finish. Please take her back. Please take her back. So finally I said, well, I don't have time to babysit, but okay, we'll take her back. So she came back, and she was a blessing. But we finally had to come to a place for her to understand where we were, and take the time for us to teach and help her to understand where she was. And together we went through the 5 weeks, and she and I together, because I could think, she could write, and she actually wrote some proposals and brought some funding in that we didn't have. That was a tremendous experience for us. So a big problem that we have is that we know what we need, but we don't know how to get it. And to find the people that know, and for us to come together and make it happen, has been really, really difficult. So we have been going out and finding and looking and searching, but we don't have the education and the knowledge that this room is full of, okay? And so now we're here saying, how can we make that happen? I see that on the display, and it's perfect for what I would like to see really happen between community and those that are funders and the knowledgeable people that are going to bring the community together. We need you, and so here we are trying to find a way to adapt. Us adapt to what we don't know, and for those that come to adapt to what we know. It's like being the street kid. We're the street kid. We know what's out there, but we don't know how to bring the information into us.
All right, so Margarita, I want to continue on that point. You said, you really know your community and what they need, and you told us a story about a clinic you had where the doctors were coming in and how some, they didn't have to necessarily be Hispanic.
No.
So can you just tell the audience of what you told us?
Yeah, we had a couple that both were doctors. We have a free clinic, and it's very third world-ish. So if you come, be ready, okay? It's not air conditioned like this, but it has done a lot of wonderful things. So we had two doctors that were a couple, and they were from Peru, I believe. But when our patients would come in, I would tell our patients, get there, because they're only there for a while. So some of them may not have had a bath. So the doctors wouldn't see them. They didn't want to see them. They treated them very poorly. But then we had other doctors that didn't speak Spanish, but they had a smile. They were loving. They were caring. So I know that it isn't about you having to speak Spanish in order to deal in our community, because that was really and when those two doctors were there, none of our people would come. They would just stay away. So it didn't matter how sick they were. They would rather keep their sickness than to lose their dignity. So I think that part of understanding the dignity of the impoverished community is vital to those that, don't have to worry about that.
I think that's a really great point. And so you're saying that it's not the importance of speaking Spanish that matters as much. It's the heart, it's the context.
Exactly. And that has been a blessing to have that interaction with the community, because we're all Hispanic, mostly undocumented. So we have a lot of fears. So if someone comes to us that is not Hispanic but is loving and kind, that's a double whammy for us. That's a good whammy, because now we have somebody that really cares about us, and it bridges that gap between cultures.
My next question is for Jeannie. Jeannie, what do you do to monitor and evaluate your program?
So the program that I work in is called the Children in Need of Services, Family in Need of Services. The acronym is SINS-FINS. Someone didn't really think that out, but anyway, it's an awkward acronym, but that's what we call it, because otherwise it's a mouthful. But I work in the outpatient part of the program called non-residential. There's also a residential program. We have a great deal of monitoring. So we have monitoring that's mandated through our funder. So the money comes through the Department of Juvenile Justice under a prevention contract and a prevention model. And then we have the Florida network that actually comes out and does our monitoring every year. But the monitoring process, to me, I think is very creative, because they do file reviews. They actually interview families that are participants, and they also look at our client satisfaction surveys, which grade us and our performance and how well we did. But the way they do it is they use people who work at the Florida network, but they also use people who are providers. So what that does is it trains us to what's expected. So not only do we know what they're looking for, but we also go and look for it in other people's programs. And so they have a quality improvement process that's always ongoing. And that's one of the ways that we're monitored. So that's the external piece. The internal piece is that we do our own peer review. We do it monthly. We go through our files, and we have a template that we use. We have a criteria. And we also do, we have a clinical supervisor, and she does spot checks. But she also does fidelity checks in terms of, she asks you, what are you doing? Why are you doing? So to ensure that the quality of the service is there. I'm trying to think of anything else. We do 60-day follow-ups with the families. So those are done by phone. And usually what they do is they'll ask people, how is it going? Are you applying the things that you need? And it's very specific, the questions that we ask. Again, those are funder driven. We do a pre-test and a post-test. And like I said, we do the client satisfaction surveys. We do have other monitoring, but that's through COA, our accreditation. and they also do very similar things.
So from what I'm hearing, it really kind of comes full circle. We're seeing it at the funder level, coming down, and even have like the county does some auditing, and then even internally you have your supervisor,
Yes.
you have you guys doing your
Right.
own, and then you're also getting feedback from your clients.
Correct.
So it's kind of all
Yes.
interconnected.
So there's a few people in administration who spot check our files.
Right.
And so not just our clinical supervisor, but we have other people who do as well. We have one person who works with the Florida Network on a regular basis. And the Florida Network also uses a database that we put information into, and they also use that as a quality check. So they have, on their website, we have access, if you're a participant, you have access to see your data. How are you doing? Are you getting enough clients? Are you serving enough families? And are you having successful exits? And if you're successful, they even give you the percentage. I mean, they track a lot of stuff.
So that piece of it's really important in terms of making data-informed decisions.
Absolutely.
And moving forward in terms of what the needs are for not only the organization but the clients as well.
Right. It's a very well thought out process.
Right. Great. Thank you, Jeannie.
All right, so this next question we're directing to the full panel, but I'm going to start with Kim. So Kim, when considering balancing adaptations while still maintaining fidelity, what are some key things you need to consider when you make adaptations or others?
We don't necessarily adapt. You mean like when helping others to adapt? We kind of have this internal adaptation protocol, and again, it just varies on how much contact we are with people who use our program. So it's, we have direct services here in Hillsborough County Public Schools, which we, work with regularly, but predominantly the program is across the United States. And, like we're on the national registry, so there's just a very large gamut of users out there. So it all just depends on how much they're willing to communicate with us. And we've always felt that a lot of times the program just gets adopted or purchased, and then we have no control necessarily on how it is that they're implementing. But that seems to be changing, funding-wise and possibly policy-wise. So we're really starting to have stronger relationships with the places that use our program. So depending on which phase of implementation they are in, we can really help them to first recognize there's probably a lot of adaptations they don't have to make if we can help them build capacity. And that takes a lot of collaboration, a lot of brainstorming. It depends on their setting, the resources that they have available. It might be, we don't have enough classroom teachers to deliver the program school-wide, but they might have, a student resource officer or a mental health professional within the school that could also assist with that. So they may be wanting to, because they believe they don't have enough resources, put 2 or 3 classes together, but they may not have to do that if we can communicate with them to give them alternative means to meet the basic requirements that would really target our model to fidelity.
Can you tell us a little bit more about, you had talked to us about an adaptation protocol, and you were kind of hinting at that a little bit before. Something you said that was really interesting was that this is a universal program. Can you tell us about what was that?
Yes. So I believe that there was a time period where universal programs, or it began to, but I don't have, proper documentation on this or exactly what it was, but it was just an experience we were experiencing at the foundation is, perhaps some funding was not going to universal programs. They wanted it to be on very specific populations. I think the practicality of that for an evidence-based program is challenging because it takes a lot of work to be an evidence-based program. It takes a lot of resources, it takes a lot of money, it takes a lot of study, and it takes a lot of years to get that, that research back to say that you're evidence-based. So we are a universal program, and I think that people are starting to begin to understand that what that means is, it was not just tested on one type of population. And speaking just about our program, it was tested here in Hillsborough County, which is one of the most diverse one of the most diverse counties in the nation. So what that looks like in a practical means when we were doing some of our efficacy studies is some schools were predominantly African American, some schools were predominantly Hispanic, some schools were predominantly white, some schools had a great mixture of all of them combined. So a universal program that speaks to the general population means that there's all types of people within it. And so as a developer of the program, we try to maintain, cultural sensitivity, gender sensitivity, socioeconomic sensitivity, that there's just examples and scenarios that meet, that people can identify with. So a lot of times when people ask the question, how can we adapt it to fit our population? A lot of it is already there, and they may not necessarily need to make the adaptations that they are thinking they need to make. If there are, we do serve some communities that are not part of what we would say like the general population. There are some tribes in New Mexico that would be, they're how we think a true cultural adaptation, that would be reasonable to make some cultural adaptations so the scenarios or the activities are more relevant to that population. However, we recommend that those adaptations are never made in isolation. It cannot just be with one person. It needs to be with somebody who is genuinely from that community, that has that heritage, not, an outsider that has said, I've worked with this population for years. Because I think that, cultural adaptations can go wrong if they are not, properly thought through, and you have people involved, the program developer, because we come with the knowledge as to what is effective, research wise, what are effective practices to do. And again, somebody from that community who's more proficient in what needs to change. And
well, it kind of goes back to that importance of, adaptations can't be made in isolation, like we were talking about the other day.
Because they can truly be drastic mutations that would not represent the integrity of the program, would not represent the integrity of evidence-based practices, especially with young people. Our adaptation protocol is just about collaboration with everyone if we have the opportunity to have that collaboration, because a lot of times it's just, our program is purchased and then somebody just goes with it, and
Right.
we don't know.
Right, yeah, that's a really interesting shift, I think, from probably how it started at the beginning.
Yes.
Now you're taking a more active role, and
I think we've always tried to have that. There just hasn't been a focus. The actual process for implementation has not been a priority, where it used to just be the priority, just get an evidence-based program, just have it in your facility, wing it if you need to, just say that you did it. And we have tried to work, but it's not the fault of anyone necessarily, except for probably just the lack of focus or understanding of how important the process of implementation can be.
absolutely. Well, thank you, Kim.
All right. So I have the same question for Margarita. I'll go ahead and repeat it. So when considering balancing adaptations while still kind of maintaining that fidelity piece, what are some key things to consider when you make changes or adaptations?
Well, I think for us it has to be that we keep the original idea of what we're attempting to do, that doesn't radically change. That we may dress it up but not change it. If that makes sense to you?
Absolutely. The other day, we Margarita and Alex and I had a conversation, and we all know, a few people in this room know I love a good analogy or metaphor. So she said putting on a plain dress and dressing it up. So the idea of the dress being that fidelity piece and
Right.
keeping never really going away from the principal idea, their core values, but then dressing the dress up with maybe accessories, and that's really where the adaptation piece comes in.
And the way we are in our community, we have to think of these analogies all the time because I don't know the language that you guys are speaking. It's almost like another language here, and I'm going, okay, I'm trying to get this. But with us, we've been very faithful about what we believe we need in our community. And that has been to work with the farm worker community, and especially the undocumented community. Never run away from that because we know that that's vital, and there's very few people that really care. But again, the adaptation comes now when we want to do something more. How do we do it? How do we get that information that we don't know or understand? Because the language, just the language here today, is not my language. But I know that we have to cross that bridge. We have to find a way to get to the other side where we know we're going to have the help that we need. Because we don't have it over here as long as we stay exactly the way we are. So we have to dress it up. We have to put on a belt. We have to
I like that you say that you add to something, and I know the work that we're doing is not identical, and I appreciate the work that you are doing, and I can't tell you how much it means to hear somebody who's willing to add to a thing, because I think a lot of times, because in the work that I'm in, there's limited time, so the adaptation is always an attempt to eliminate something. And we are just like, if you can stick with the dress, and then if you would like to add a belt and some earrings and a handbag,
Amen.
That's probably
White is my color.
that's probably better. Yes.
But I think also, the experience that we had with Lacey and Rebecca, of them coming into our community, and more than once, several times, and listening to the young people, listening to the moms and dads, listening to the different groups that we brought together so that they could get a sense of what we were wanting to do and what we needed. And we're in a community where nobody cares. We're in a very impoverished community where everybody's afraid to go there. And Diane and I have lived on that street for 40 years. Well, me 40, her less. But it's our community. And so how do you grasp all of the things that are there that need to be fixed? So we have to do that transition. We have to learn adaptation, and at the same time, share what we have with those that are going to come.
Yeah, for those of you that don't know, Lacey and Rebecca are two of our Institute scholars in our most current cohort. They'll be presenting later today. But that's interesting that you mentioned that it was very important to go into the community, be on their level, build that rapport and those relationships in order for them. They did a needs assessment looking at the behavioral health needs of this specific population. So that was an important component for them to be able to do that effectively. Thanks, Margarita.
All right, and Jeannie, I'd like to hear from you as well. And I'll repeat the question again. When considering balancing adaptations while still maintaining fidelity, what are those key things you need to consider when you do make changes?
Okay, so I just a little bit of background. The program that we have for outpatients specifically is up to 12 weeks. So there's a lot of framework that's put in place by the funder. And so if you want to go past the 12 weeks, so say for example, there's a traumatic event in a child or a family's life, and you have 3 weeks left in therapy, our funder is not like, okay, your 12 weeks is up, you have to finish the case. So what we do is we have a procedure that we use, and we can actually make a request, what we call as extension of services. And all you have to do is provide clinical relevance. You submit it to your supervisor. Your supervisor then monitors the case. In fact, last evening I did have a conversation with my supervisor regarding one of the cases that we had extended and checking in to make sure, where is the family now? Are they ready to exit? And actually they are ready to exit based on the fact that we were able to get more services in place for the family. So what we do is we have to look at, if the program, if the integrity of the program is set up a certain way, you know, how do we actually fit what the funder's looking for? And all we have to do, they're very flexible. I mean, they are, in fact, they're even doing their own adaptation because they've produced another program in response to a need. So they're a great funder that way. So we've had a lot of luck with that.
It's a rarity to hear a flexible
Right.
fundraiser. Well, Jeannie, I want to continue on with you on to the next question. This will be our final question for our panelists, and then we will open it up to the audience. So, Jeannie, what do you see as the critical steps in implementing a new program?
So, well, I'm going to speak specifically to a program that I implemented, and what I did was I worked with a community provider, and I developed a group for 10 to 12-year-old children. And what had happened was the need that was identified, it's more anecdotal, but the need that was identified was children who are transitioning from elementary to middle school don't make that transition extremely well. They don't have a lot of executive functioning skills. A lot of the middle schools don't require planners, so there's a reduction in communication with the parents. But there's also a reduction in that structure that's already in place, that, you know, where assignments get written, et cetera. And so what we did was we were kind of responding to people saying, I wish you could do this, I wish you could do this, I wish you, and so it was group, children who kind of look like they might have some ADHD type symptoms, but it's probably more developmental because they're just not really ready for middle school yet. And so it focuses on that executive function, developing those skills. And we called it Adventure Club, so we made it fun. It was a skill building program, so it fits within the prevention model. So we have to fit the model, you know, that's the big thing. So what's critical is buy-in on multiple levels. So we were able to find a location. One of the things that we struggled with was getting into a location. A lot of people told us they wanted us. Then we would knock on the door, and some people weren't even getting phone calls back to say no thank you. So we kind of started with one, you know, idea of being in one type of a location. We ended up in the rec centers and the county rec centers. So that's where the program took place. And also recruiting, making sure that there's time to talk to the parents about the group. We had a real difference in buy-in if staff at the rec centers were identifying children they thought should be in the group versus parents listening to a description. So when I went to a parent meeting and I described what the program was, we just had a line of people, and I was just like taking names and we were calling people to get them in. So it actually turned out really well that way. So we made sure that we fit the model from our funder. We made sure that we had a proper location, so for confidentiality purposes. We also needed to still do the same assessment because you don't want to take a child into a skill building group that actually needs mental health counseling. Mm-hmm. So we did a lot of vetting that way to make sure that everyone who was present was available, you know, was able to be in the group. And then obviously just making sure that the parents had our communication. They understood what we were doing and why. And we even had some kids who were under 10 who wanted to be in the group. And then once the group got rolling, we made an additional adaptation. And that adaptation was for a participant who is on the spectrum for autism. And what the group was designed to help skill building by giving each person a different role every week. So it was a story. It started out day one, a story that led all the way through the 6 weeks program. And so they participated in different roles. So when you got your backpack every week, you looked in and you found out who you were going to be that week, what role you were going to have. Were you a leader? Were you in charge of, you know, navigation? So anyway, we made a modification so that this young man could continue. And what we did was we made him our scribe. But he was he drew. So at first he was just drawing what he wanted to draw. And by the second or third week, he was actually drawing what was happening in the story every week. So we did make that adaptation for him so he could stay in the group.
And how responsive was the funder to this kind of innovative addition to an existing prevention model?
Well, from what I understand, the funder is very, is satisfied with it. But we are going to have our annual auditing soon. And so apparently that's going to be on the table. We're going to have a conversation about Adventure Club and see how they feel about it. We met all their minimum requirements, so hopefully they'll be satisfied with the level that we went to in terms of the executive function, the different ways that we introduced it. And one of the things that we did have to do for the provider that allowed us to come in was we had to include STEM. So my supervisor, who's actually here today in the back, Ms. Linda Sessions, ran out to Walmart and had to buy compasses, and we learned how to read a map and use a compass, and so we integrated it into the program as well.
That's great. Thank you, Jeannie.
You're welcome.
I actually have a follow-up. So when you were initially developing, I think we discussed that you were trying to develop something because you were trying to meet a need, and that actually individuals in the community came to Children's Services to ask for you guys to come in and do something specific.
It wasn't really that direct. It was more any conversation we would go out. So we do outreach. We're required to share with the community what our program is and how it works. And we would get a lot of, we would like you to do this. We need this. And a lot of conversation would talk about prevention. The program is funded through the Department of Juvenile Justice. The goal is that when children are successful in their multiple environments, at home, at school, it reduces the likelihood of them engaging in any type of inappropriate behavior. So, and the research does support that. But the way it works for that is, okay, if you're transitioning from elementary to middle and you're not making that transition well, it supports that idea of making sure that transition smooths out. So when we would be talking, a lot of times they'd be like, we have a ton of kids here who have this, and everybody likes to label all the children, but I'm not going to say that because that's not always accurate. But the thing is, then we started listening to the theme, and the theme is the transition. So I would hear it from the after-school programs. I would hear it from school administrators. I would hear it from parents. We would also see it through our truancy program, because we do have a truancy program where children are attending school pretty consistently through 5th grade, and then they hit middle school, and all of a sudden the wheels fall off and they stop coming. So we got information from a bunch of different sources.
Thank you, Jeannie. You're welcome. So moving on to Kim, what do you see as the critical steps in implementing a new program?
Building capacity, making sure that what the settings needs are actually match what the program can do. And I think without helping them to install the program in their setting, so much can go wrong. So we try as best as we can to be informative, to be creative with them, like I had said before, to basically build capacity. But I would say the most important, and you had mentioned it you called it trialability. That's a perfect word. Also known as initial implementation, which I think a lot of times is missed. There's a gap there of understanding from the funder to the actual provider. If they're saying you need to show your outcomes or report your outcomes in, the second year, third quarter, people aren't necessarily thinking, okay, well, I can actually do if that's what you were meaning by trialability, maybe not necessarily. Yeah. So there's a moment where you could actually put into place the full implementation of a program. For our program, like I said, it's 10 weeks, but it doesn't just necessarily mean the teacher delivering or facilitating the lessons once a week. It's also distributing the pre and the post test, having a team available at the school or the setting to, to conduct classroom observations. This is the process outcome side. So there's the student outcome side where you give the pre and the post test to measure those outcomes, but then there would be a team in the school that would practice classroom observations, and the facilitator would do their Fidelity checklist. And then there's someone in place to collect the data, somebody in place to analyze the data. Without that practice, because during that practice or that trial run, basically, of the program, you can work out a lot of kinks. You can see where you're going wrong. You can see where you're doing well. We can offer better suggestions for when full implementation happens. After that phase, you actually have to report your outcomes to the funder. So when you have that practice run, like I said, you can just overcome a lot of the barriers in that process. So I would say that's, if everybody is, hoping for strong student outcomes and to, make a significant impact in a child's life, it can't just go from, okay, we got the program and now we're just going to do it and then we're going to send in the results. have, make space for that practice because it really matters.
And also in that trial run, that could be a potential time to, if it's necessary to make small adaptations, that would be a good time to do it in order to assess and monitor that, to see how it would impact, before we go full scale.
Yes. So in the example again, if you have that, you take a quarter of your school year and implement the program, but you don't have 10 weeks, so you do 9. I mean, right there you can see, you get, you do your pre and post test and you look at your process outcomes to see where, maybe it works great. Okay, so then you can move forward with that adaptation. But if not, okay, let's step back and see how we can get that extra lesson in. And that's just one example of a common adaptation in that type of setting.
So we talked also the other day about increasing recognition from funders on the importance of Fidelity, and then also kind of changing the nature of the involvement of like a program Fidelity or a program developer in that process. Can you tell me a little bit more about that?
Can you repeat that?
Sure. So the other day we were talking about increasing recognition from the funders on the importance of Fidelity.
Yeah, I think that I have encountered many examples of particular grants that just distribute the money, and actually there's no outcomes necessary, but there's still people. One example at the state level, they're about to, implement statewide. They are still going to collect those outcomes and still report them back to the funder. I think that people at the state level, not necessarily at, a local school or a local community setting, they are doing the work, I think, on behalf of us to communicate back to policy, to communicate back to their funders. You're not necessarily requiring, let's say that they do require student outcomes. There's champions up there saying you also need these outcomes over here, and just whether they want them or not, showing them those outcomes and the importance. Because if not, you have evidence-based programs that should be producing really great outcomes, but if you're not looking over here at the process outcomes, then it's starting to look like evidence-based programs have little to no effect. So I'm not sure if that answers exactly. Okay.
Thank you so much, Kat. So moving on to this is our last speaker on this, our last question of the panel. So what do you see, Margarita, as the critical steps in implementing a new program?
Well, I think for us, we have touched on a lot of different things in the years that we have been working with the organization, but we haven't been able to find a real strong partnership between the funders and the organization, and being able to come together, to understand each other, and to be able to come up with a good plan. We have little bits of everything, but nothing that has ever been able to come together.
For sure. I remember we were talking about there was something in the high school where they were. For example, we work with everybody that has issues with the farm worker community. So there's a social worker that works in the high school that is very friendly with us, and anything that is happening at the high school level that she thinks we might be interested in or need to help, she'll call us. And again, we had, because of immigration and the issues that are happening right now, a lot of the kids were just not going to school. Their grades are going down, and their morale was really bad for the farm worker kids. Kids that were either American citizens with undocumented parents or vice versa. And so we talked together, and we have come up with a plan that if they will invite us to come and bring the kids, because we have some kids that are really, some of our kids are really okay and they're doing good stuff. So if we pull our kids and take them to the high school so that we can have a conversation, that maybe we could help pull up the morale of the kids that are feeling that there's no hope. Because one thing that our organization does is believe in hope. We have hope. We're going to figure out how to do it. But a lot of times finding a way to
to have funders understand us. And we have heard, and we have had to walk away from some things because it was so not going to work. And we needed their money, but they didn't understand us, so we had to walk away from it. And that's really hard. So hopefully that these kind of conversations that we're having now may be more helpful in how can we come into a community where the need is outrageously there, but no one's coming to help. How can we bring that to the surface, and how can we have, USF is not that far from Dade City. And I was just asking Diane, did we get a response from the president of PHSC? And she said no. And I said, well, we'll send him the same letter and just say letter number 2. Because here's a college right down the street. A mile away.
Yeah,
A mile away. And they have a nursing program. How could they help us? We have the free clinic. How could they help us, and how could we help them? And nothing. So for us, it's identifying people that care about what we're doing, and then us understanding how to find them and how to make that match hold. I guess we don't know the glue. We don't have the glue yet.
Yeah, so really that importance of collaborations and good relationships between community partners and other influencers, kind of like USF.
Right.
Maybe USF coming into the scenario to maybe give, have more of a presence with a funder in order to assist farm workers a little bit more to get the services and resources that are needed for the organization.
We're a member of TBCCN with Moffitt, and because of having that relationship with Moffitt, we know that there's a lot of people that are alive today, undocumented farm workers, that would be dead if we hadn't had that navigating skill. So we have some good skills. We just don't know how to make it all come together. And so again, I feel like a fish out of water here, but I know that I want to learn, and we want to learn. We want to find a way to learn how to adapt. And hopefully we can show you how to adapt to us.
Yeah, I remember we talked about the idea of, providers needing to have that awareness of the organization and then the community before they can buy into it. And that's a really important piece of it, kind of like with the student you were talking about in the beginning of our conversation.
And it's also like, people have dignity, and you have to figure out how to not take that dignity away from them, no matter how poor they might be. We have a thrift store. We could give everything away, but we saw that it didn't help people to give it away. So if something cost you 50 cents for a new shirt or a shirt, then that's yours. You bought it, and you keep your dignity. The same way with all the things that we need to do in our community. And I thought that was what was so neat of having Lacey and Rebecca there, because we developed a relationship, and they developed a relationship with the people there. And it was really fun listening to some of the things that our people said that they would have never said before, but they felt like they were in a very comfortable zone, so that they could share their stories and the desires for their children. The situation with drugs, with suicide, we have all of those things. Less because we're there, but they're still there. We have to find that place where we can come together and really bring that community up into a place where it can really shine.
Right, so in terms of those critical steps, we're talking about building that rapport with the community, understanding, having buy-in, having that really good collaboration and people on board to help you get those resources. And then I think I also remember us talking about the idea of using numbers and data. Although that may not, sometimes isn't the best way to do it, but sometimes it's the best way to really give the idea. And I remember you giving the idea of the gentleman who died of prostate cancer. Can you tell us a little bit about that?
Well, I think that our organization, some things, like, it's kind of like the cart before the horse. Some things we've done at different times because of the need. And we had a gentleman that was a very dear friend of ours, and he died of prostate cancer. Well, after he died, we realized that that didn't have to happen. That there's ways, and teaching and learning. So we were able to begin to deal with the cancer issue. And so we do a lot of education around breast cancer, cervical cancer, prostate cancer, and HIV. Everything that we could learn, we've tried to share it with our community. But now, again, what's the next step to make it even bigger and better? My vision is to see a free clinic, a beautiful free clinic, in the middle of that community. Because, it's funny how things are always built somewhere else, not where they ought to be, not where they need to be. So now other men are alive because of that, because we learned a lesson, and we began to teach, and we began to share, and we began to find ways for people to get to where they needed to go. So we're great navigators. I think that we've learned to be very good navigators. We could be great attorneys, because we've learned a lot of good stuff there too, especially around immigration. But there's this need that we have about mental health. Mental health is vital. I think we finally, Diane and I were talking about it the other day, about how we've worked to build so many different things for the farm worker community. But when we began to learn about crime survivors and what happens to the community when a person is broken, and certainly I was broken, so I should have understood that. But when I really saw it, then we developed a chapter under the Alliance for Safety and Justice for crime survivors, because I got to thinking, well, no wonder our community can't change, because we're all broken. So now we're asking you, how can you help us find a way to have better mental health? Because there isn't any for us. If you're undocumented, you can't go anywhere and get it, because it's not there for you. You don't have the right papers, so you can't go. I think everybody should be entitled to have a good mind, and a healthy mind and body.
Thank you, Margarita. I appreciate everybody on our panel today. I really want to thank Kim, Margarita, and Jeannie for joining us today.
Thank you.
And shedding light on this really interesting topic. And also thank you for the truly incredible work you do in our community. So thank you. Thank you, guys.
So with that, we do have time to take some questions from the audience.
Hi, thank you. As a funder of evidence-based practice trainings, I'm wondering, do you work with the developers around these adaptations? It seems to me that some of the responsibility lies with those developers who, really make quite a lot of money, because a lot of these EVPs are expensive, and they don't have trainer models. So we fund the trainers to come in to train practitioners. What is their responsibility to provide culturally informed materials, trainings, resources, to test their models more, to work with us on these adaptations?
That's a really good question. It's something that we try to, our relationship with people who use the program is, we try to have as much relationship as we can with the people using our program. As far as cultural adaptations, it does take a lot of work to create them. They can be kind of, how can I phrase this? I can only speak to this about our program, is the best that I can say. So our program is scripted. We have student workbooks, we have card games, board games that all have context on them. We have role plays that are on them. We have, this is where I could go in so many different directions, so just you might want to reel me back in. But for example, we have a lot of our materials produced in Spanish. We have, and that works if you're in a class that is would need to be completely Hispanic. People have attempted using them in what we know in Hillsborough County as like ESOL classes, where you have students there that are learning English as a second language. In my personal opinion, this would be an example that can go tragically wrong, because I've seen it happen before in ESOL. People wanting to have the Spanish material, but there's somebody in the class that speaks Creole or Chinese. Mm-hmm. And so what is the impact there? For our type of program, for it to be, available in multiple languages, would take an extreme amount of resources to create that. So because we don't have those resources, to make, let's say, translations in many different languages, that's where we try to work with the people and their knowledge of what the cultural adaptation needs to be. We assist them in how to physically adapt or change. I mean, it could be taking white out on a role play card and, typing it in. It's a very difficult process to do. In the same turn, I think it's extremely difficult for programs specifically to minority populations to be made. I think it's, because they are minority populations, it's very difficult to produce an evidence-based product, one that people have access to meet the needs of all those different populations. The research alone takes years to gather, the efficacy on that type of program. So for cultural adaptations, I don't necessarily know the solution. I know we try and we work, diligently to try to be there to make those. Ours is a universal program. And I think a lot of times people choose to use a universal program because you can make some type of adaptations, or at least because the research is there that in some capacity it's evidence-based, it shouldn't cause more harm than good to a particular student. But I think the process of making cultural adaptations for the design of some programs, and ours being one of them, it's a challenge. But the heart and soul behind it to do so, for us as an organization is there. It's not just like we're, only doing this type of program because that's what we are going to, meet the needs of. No, we're there to, work and partner with somebody who also is willing to do so.
So I have a question specifically for Margarita. When evidence-based interventions are being evaluated, a lot of the times the migrant and undocumented community is silent, unless they are in the schools, but overall they're not included a lot of times.
Right.
So what do you recommend to the researchers of ways to include that community when evidence-based interventions are being evaluated?
Well, it's kind of interesting because I work with Judge Tepper. She just left the bench. She's very involved in trauma situations and children, and they had I guess the sheriff's office, the social workers, they had done some kind of survey, and this may not be exactly what you're asking, but it reminded me. They did a survey and they brought the program to everybody, and I was looking at it, and there was nothing in it for Hispanics. Nothing. And I said, how can this be any good if it doesn't have them in it? You know, so I'm not very popular sometimes because I said, now you got to go do it again because it had nothing. So generally, there isn't enough. You know, it's like they have daycare, but if you don't have Social Security, you can't really get anything done there. Sometimes even the counselors that they have are not always the ones that are appropriate for our community. And even though sometimes we don't know a lot, we have senses, we feel. And so that's a piece that's really missing. And I don't know how we're going to bring it together.
So one of the things I wanted to add to that, since I'm totally like all about our funder, which I know is an unusual relationship to have, but in terms of diversity, our funder actually provides us with extensive amounts of training. Your first year as an employee, you're mandated to have 80 hours of training, and then after that it's 40. When you add up the number of hours of training that we participate in annually, it's our direct care staff in the residential program basically get over 100 hours a year of training. And right now the focus is on LB, somebody help
I can't
me.
say it either.
Q, and also gender identity issues. And so right now, our funder has mandated that we change our forms, we change our procedures, and we make sure that anyone who has, basically how they identify gender-wise, we address that even in our residential program. And it's been very helpful to us because they even produced, it looks like a comic book. One side is for the children, you flip it over like a regular comic book, and the other side is for the parents. And it's about how to help your child. And we even have access to those. So in terms of diversity also, they look at our treatment plans, they look at our psychosocial assessments. They have to be culturally relevant. We get dinged if we're not culturally relevant, which means we have to ask a lot of questions. But that is required of our program.
So you are perhaps in the best position. You to address this. You are the one where the tension is converging right over on top of you. With the Fidelity, I mean, you have a really great situation with your funder.
Mm-hmm.
That's great. You seem to, obviously have a good sense of the need or how to figure out what the need is from your clients. So I'm just wondering, like, how does this figure resonate with you in terms of how things are coming together when you are implementing programs, so the impact on your organization?
When you say how does it resonate with me, well, I'm looking at it, and I guess what I think a lot about is because of the relationship that we have with our funder, we have a different kind of stress, because the stress is more about communication and understanding expectations. We don't really live with the threat of you're going to lose your funding from our funder. We have different pressures, actually. We have a pressure being a county provider, that the county often asks itself the question of why are we in the business of providing mental health services to families, respite services to families, and also foster care services, which is another program that we have. So this tension that we often experience is the tension of, is the county going to keep taking us on? Do they want us to serve families in the community? Now, you can ask the families we serve in the community, and they'll tell you they love us and they're happy that we're there. We do get a lot of credit for going above and beyond to assist our families. But that's really a tension that we feel because it's driven by kind of people's philosophy at that time. So if we get different people into office and they have different opinions about the business that we're in, then we may not be in business anymore. And that's a reality that we live with. So one of the ways that we manage that tension is we make sure that we dot every I and cross every T. I work more than 40 hours a week. I usually work about 50. That's on average, but we're there to basically demonstrate to the citizens that their money is well spent. So we do back up our funding with county money. But I think that's one of the tensions that we live with. One of the nice things that we have is that basically evidence-based practice is mandated. It's not just mandated through the funder, it's a professional requirement. I mean, our professional associations are looking for it, and obviously the county is, our accreditor is. So we're really, it's more about kind of like making sure that we're doing it in a way that everyone who is a stakeholder knows that we have the investment and that we have the commitment. One of the things I thought was very interesting is when COA came out and did our accreditation, one of the things that they said to us that shocked them was when they interviewed our youth, they'd say, who was your favorite employee, staff person? They didn't have one that had a list. And the therapeutic tool of the relationship is where the priority lies, and they've got it. So to me, that's kind of like we have all these different kind of tensions in a weird, strange way. I don't feel that pressure anymore, but I have in the past. I've actually been someone who had to walk away from you many years ago when I had a different funder who said, no social security number, no go. And we begged them to let us go out and work with you guys.
Mm-hmm.
And they said no. And we had to walk away. And it was heartbreaking.
Mm-hmm.
I don't have that right now. I mean, right now I'm in a really good spot. I'm pretty spoiled. So we have different tensions though.
Well, we need you over there too. The one thing I did want to share is that probably the most important thing and the first thing is that our community doesn't know a lot about mental health. And I think it's almost like any poor community, whether they're white, black, or brown, if they don't have any knowledge of who and what it means, what it's going to do for you to have a good, mental health, then that's a place where we should start. And it should be accessible. Kids, especially in our community, the kids it should be accessible for them to find a way, and there isn't any. So right now, one of the things that we're doing is that we're connecting with Mormicans, who was a school that was the last bit of history, black history, that they had in Dade City, and they closed the school down. So one of the powers that be told me, go because I can't go and organize. So we went, and we kept the school open for a year. Then they started taking the programs out. Well, what we're doing now is that Mormicans is pretty much a black community, so we have come together, and we're working together to learn together. We're trying to figure out ways to help each other, and we've rented that school for the next 30-something years for $10 a year from the school district. We hope that eventually we get to keep it. So our whole thing is to find our impoverished gaps in East Pasco, bring them together so that we become a strength, and then work to find ways to help each other. So the mental health is needed in our community, Tommytown, but it's also needed in Lacucci. It's also needed in Mormicans. So there's some things we do know how to do, but we just don't know how to do this. So learning how to adapt, learning how to do numbers. Diane is wonderful. She has been very helpful to me because she does numbers a whole lot better than I do. And a lot of times we're so busy working that we're doing the work that we don't have time to do all of those things that we need to do because we don't have enough people to do it all. So that's a little bit of an excuse. But we're willing to learn. We're willing to learn, and I'm just so grateful for the opportunity to be here, even though it scared me to death. So.
Thank you so much, everybody. Thank you to our panel.